Have you ever wondered why something as simple as waking up at night can lead to life-threatening consequences? Imagine this: a 70-year-old man in the middle of the night just wants to use the bathroom, suddenly collapses and tragically passes away. How could this happen? In today's video, we will dive into an important health issue that affects many older adults. We'll explore a critical health concern for many seniors waking up at night. You might think it's just a minor inconvenience, but it could signal something much more dangerous. A small annoyance, yes, but it could be a warning sign of something far more serious. Whether it's a rapid heartbeat, dizziness, or sudden falls, the risks are much higher than most people realize. We'll find out why waking up at night can pose severe health dangers and how it can affect your overall well-being. This video isn't just for those struggling with sleep issues. It's for anyone concerned about the health of their loved ones. You'll learn essential tips on what to watch for before getting up, common health problems that make nighttime trips risky and simple, yet effective precautions you can take to protect yourself or family members. Stay with us until the end to discover expert advice on how to safely manage nighttime urges, prevent falls, and important steps you need to take to maintain better sleep health. Plus, we'll talk about how small changes in habits can make a big difference for older adults. Don't miss this. This could be the key to a safer, healthier lifestyle. If you haven't subscribed yet, please subscribe and turn on notifications so you won't miss any videos. Your support means a lot to me. And if you like this video, you can help me keep sharing valuable lessons by liking and sharing it. If you love the topic, please comment below. If not, please comment 0 to let me know how I can improve and create better videos for you. Now, let's get started. The doctor's words couldn't be clearer, and they carry a weight we can't ignore. He specifically points out that older adults face significant health risks when they wake up in the middle of the night, and these risks shouldn't be underestimated. This isn't just a minor inconvenience. It's a serious health issue that needs attention. For seniors, waking up at night can hide dangers, especially if they're unprepared or don't take proper precautions. Please share your thoughts on the topic of this video. If not, kindly comment with the number 0 to let me know how I can improve and create better videos for you. Now, let's get started. The doctor's words couldn't be clearer, and they carry a weight that we cannot ignore. He specifically points out that older adults face significant health risks when they wake up in the middle of the night, and these risks should not be underestimated. This is not just a minor inconvenience. It's a serious health issue that needs attention. For seniors, waking up at night can pose hidden dangers, especially if they are unprepared or do not take the right precautions. This issue is not merely about disrupted sleep. It relates to their overall safety and health. So, what should older adults keep in mind when getting out of bed at night to avoid jeopardizing their health? The simple answer to this question is that we should not overlook the issue of waking up at night in older adults. But let's delve deeper to understand why many seniors struggle with waking up at night. If you have ever found yourself lying awake frustrated by you can't fall asleep or suddenly wake up in the middle of the night, you know how annoying that can be. For older adults, this problem is even more pronounced. Sleep is very important for maintaining good health, and frequent insomnia can lead to many serious health issues. It's not just an inconvenience. It affects both physical and mental health in seniors, leading to complications like exhaustion, weakened immune systems, cognitive decline, and most worryingly, falls or accidents when trying to get up in the dark. Now, you might wonder exactly what causes these nighttime disruptions. Why do so many older adults find themselves waking up in the middle of the night? One of the main reasons is emotional changes. This is something many overlook, but emotions can deeply impact sleep, especially for seniors. Research has shown that a person's emotional state before bedtime plays a crucial role in whether they wake up during the night. If someone feels anxious, stressed, sad, or even overly excited before going to sleep, the risk of waking up at night increases. This is because heightened emotions can cause nervous tension in the brain, triggering alertness instead of relaxation. The body and mind remain active, preventing the deep restorative sleep that older adults desperately need. Emotional turmoil disrupts the natural rest process, making them restless and more likely to wake multiple times during the night. But emotional factors aren't the only cause of waking up at night. Another major element to consider is diet. This is often overlooked, but can have a huge impact on sleep quality. The food we consume, especially in the evening, directly affects how well we sleep. For older adults, eating the wrong foods or overeating before bed can cause significant problems. When we eat too much or drink a lot before sleeping, the body has to work harder to digest, and this process can interfere with the relaxation needed for sleep. For many seniors, this means dealing with discomfort like bloating, stomach pain, or indigestion, all of which make it hard to sleep well. For some, the discomfort can be so severe it causes them to wake several times during the night. Furthermore, what we eat is just as important as when we eat. Eating spicy, greasy, or sugary foods can make things worse. These foods not only cause discomfort, they also affect the body's natural ability to regulate blood sugar, which can lead to more severe sleep disturbances. For example, spicy foods can cause acid reflux, often waking people up at night. Heavy or greasy meals take longer to digest, forcing the body to stay alert while processing food. These eating habits worsen the problem, making it easier for seniors to wake up feeling restless and uncomfortable. Additionally, older adults usually digest more slowly due to age-related changes in their bodies. When digestion works less efficiently, the ability to process food and absorb nutrients is affected. This can cause bloating, stomach discomfort, and other issues that disrupt sleep. Therefore, seniors need to pay attention to their eating habits, especially in the evening. A lighter, healthier dinner with plenty of water and fiber can help you sleep better. It's important to avoid overeating and be cautious with caffeine, alcohol, and sugary foods, as they can cause you to wake up during the night. Waking up at night, although common among many older adults, often signals underlying health problems, and it's crucial to recognize the factors that may contribute to these disturbances. Some conditions like kidney abnormalities or diabetes can lead to frequent waking during the night. Especially for those with diabetes, they may experience significant blood sugar fluctuations, which can affect kidney filtration and disrupt normal kidney function. This can cause them to wake multiple times to urinate at night, so the issue is not just waking up, but managing the conditions causing it. For diabetic patients, controlling blood sugar is very important, and this becomes more urgent as they age. On the other hand, prostate problems are a significant concern for aging men. Enlarged prostate or bladder infections can cause disruptions in normal urination, making it difficult for men to fully empty their bladder. This often leads to frequent nighttime bathroom trips and an urgent need to urinate. These conditions don't just cause inconvenience, but also significant distress, impacting quality of life. Therefore, understanding the root causes of waking up at night is essential to effectively address the problem and ensure everyone can enjoy uninterrupted, restful sleep. However, even after understanding the causes, it's important to consider necessary precautions to avoid making the situation worse. For many middle-aged and older adults, especially those who wake up at night to use the bathroom, acting improperly can lead to serious health consequences. Suddenly jumping out of bed and rushing to the bathroom may seem harmless, but it can cause dangerous spikes and fluctuations in blood pressure and blood sugar levels. This sudden exertion puts significant stress on the body, especially for those already suffering from heart failure. In some cases, the body's intense reaction to these quick movements can cause blood to rush to the brain, leading to dizziness, fainting, or even a stroke. If you're still watching this video and find these lessons helpful, please leave a comment below to let me know you're still with me. Also, the darkness at night often brings more risks for older adults due to decreased vision and weaker bones. Even a simple fall can lead to serious injuries like broken bones or dislocations, especially for those with osteoporosis. Their frailty increases the risk of fractures even from minor slips. Therefore, older adults must be very careful when getting up at night. Moving slowly, cautiously, and without rushing can reduce the risk of injury, helping to ensure their safety and well-being. It's important to be calm and measured when leaving the bed to avoid physical dangers caused by sudden erratic movements. Moreover, staying warm when getting up at night is an important but often overlooked precaution, especially for older adults living in colder climates. They are particularly vulnerable to temperature changes due to reduced ability to regulate body temperature and a weaker immune system. When stepping out of a warm blanket into a cold environment, the body may respond to the chill by constricting blood vessels, which restricts blood circulation and can cause discomfort or even health risks. Therefore, it's crucial to dress in layers and keep warm when leaving a cozy bed. A simple action like putting on an extra layer or wearing warm slippers can help protect older adults from the harmful effects of cold. Preventing complications that may arise from sudden temperature changes is essential. Avoiding cold water may seem like a small tip, but for older adults it can be a life-changing habit for better health and comfort. Many seniors, often out of convenience or habit, have developed the routine of drinking water in the middle of the night, right after waking up. However, this habit can pose serious health risks that many may not realize. When the body is resting or sleeping, it's very vulnerable to outside changes, and suddenly drinking cold water, especially after hours of lying down, can cause an unwelcome shock to the system. We need to acknowledge the reality that as people age, their digestive system gradually weakens. The ability to break down food and absorb nutrients decreases. This process becomes even more sensitive. The digestive tract, which is at rest, suddenly has to overwork to process cold liquids, causing it to spasm. This can lead to a range of uncomfortable symptoms like stomach pain, bloating, nausea, and even diarrhea. It's easy to overlook how simple actions can affect your health. But drinking cold water right after waking up in the morning can seriously irritate your stomach lining and disrupt your natural digestion. The problem doesn't stop at digestion. The kidneys, which filter toxins and regulate fluids in the body, face increased strain as we age. Drinking cold water late at night makes the kidneys work harder. They struggle to process the cold water quickly, which can throw off their natural functions. Moreover, drinking too much water at night can cause frequent waking because the kidneys are overworked, processing the water, making older adults get up multiple times to urinate. This not only interrupts sleep, but also prevents the body from fully restoring and rejuvenating itself, which is especially important for seniors who need rest to recover their health. So, how can we reduce nighttime awakenings? The key is not only to avoid cold water, but also to pay closer attention to how much water we drink and our overall habits, especially before bedtime. One of the most important changes is adjusting your water intake before going to sleep. Many people, especially seniors, tend to drink a lot of water in the evening, thinking it will quench their thirst during the night. However, drinking too much water before bed can do more harm than good. Consuming large amounts of water before sleeping increases the metabolic load on the body, slowing and complicating digestion. This can cause discomfort like bloating and nausea. The digestive system needs time to process food and fluids in the stomach. But drinking excessive fluids before bed can slow digestion, making it harder for seniors to fall asleep or stay asleep. Additionally, this extra water can disrupt the body's natural balance, causing swelling in the feet, ankles, and other areas from excess fluid buildup. This condition, called edema, can be uncomfortable and interrupt sleep. Older adults, especially those who habitually drink tea or other beverages, may find themselves consuming more fluids than they realize. This increases the chances of negative effects from drinking too much water, so adopting healthier drinking habits is essential. So, what's the solution? Moderation is key. Seniors should aim to drink enough water throughout the day, but limit their intake as bedtime approaches. Proper hydration is crucial to maintaining body functions, but drinking too many fluids right before bed can place unnecessary stress on the kidneys, digestive system, and overall comfort. By managing fluid intake before sleep, older adults can reduce the risk of discomfort like bloating or frequent nighttime urination. Besides controlling water intake, developing healthy sleep habits is essential to improving sleep quality and reducing nighttime awakenings. In today's fast-paced society, many people face constant pressure from work, family duties, and various responsibilities. This stress often leads to staying up late, which can disrupt the body's natural sleep cycle. While younger people can sometimes manage on less sleep, seniors need adequate rest to maintain optimal health. Without enough sleep, the body can't fully recover, leading to a higher risk of health issues like high blood pressure, weakened immunity, and cognitive decline. For older adults, establishing a consistent, healthy sleep routine is crucial. Experts recommend going to bed at the same time every night, ideally between 10 and 11 p.m. This helps regulate the body's internal clock and ensures the body can enter the most restorative phase of sleep. By prioritizing sleep and creating a quiet, relaxing environment, seniors can ensure they get 7 to 8 hours of sleep, which is necessary for recovery and rejuvenation. This sleep helps the body recover from daily fatigue, strengthen the immune system, and support overall health. To reduce nighttime awakenings, you can also create a bedtime ritual to help relax. This might include reducing screen time an hour before bed, practicing gentle stretching or relaxation techniques, or listening to soothing music or nature sounds. Taking time to unwind before sleep helps the body shift from a busy daytime state to a calm, peaceful one. If you're still watching this video and find these lessons helpful, please leave a comment below to let me know you're still with me. Avoiding eating before bed is essential for maintaining good health, but many people often overlook this. Over the years, I've seen friends and family members snack late at night, often eating large amounts right before bed. They believe that eating before sleep helps them rest better, and that a full stomach brings comfort. Sadly, this is not true at all. When your stomach is overloaded, especially with fatty or greasy foods, your body can hardly rest properly. The digestive system has to work continuously to process everything you've eaten, and as a result, your sleep quality suffers. It's like your body is running a marathon when you're trying to relax. Over time, this habit harms digestive health, weakens nutrient absorption, and prevents the body from healing during rest. Worst of all, it causes lasting damage to your metabolism and overall health. We all deserve better than to undermine our health with bad habits, especially the habit of eating too much before bed. Avoid this habit. Foods high in salt, spices, and grease can make you feel overly thirsty and disrupt your natural sleep. You might wake up feeling parched, gulp down water, only to find yourself tossing and turning all night, unable to rest peacefully. Next, pay attention to stimulating activities before bedtime. I can't stress enough how important it is to eliminate all noise, both physical and mental, before you go to sleep. I've seen many people mindlessly scrolling on their phones, watching videos non-stop, or engaging in other stimulating activities right before bed, thinking it's harmless. But the problem is, our brains aren't designed to handle this emotional overload, especially when we're trying to relax and fall asleep. Instead of calming down, your mind becomes as active as an engine running at full speed. This can lead to more anxiety and make it harder to sleep. If you already struggle with insomnia, like many of us do, at times, your bladder will easily send signals to go to the bathroom in the middle of the night. That's just another thing causing your sleeplessness, right? So, why not choose a gentler, more relaxing approach? A calm evening routine works much better. I recommend giving yourself space to unwind with a gentle massage, or listening to soothing music to bring you into a relaxed state. That's the kind of relaxation your body and mind need to enter the calm, peaceful state that sleep requires. For those managing chronic conditions like diabetes, high blood pressure, or kidney disease, getting enough rest can be even more challenging. I've seen many people struggle with waking up at night despite their best efforts to maintain healthy habits. If you're facing this, it might be time to consider medication to manage underlying conditions, but this is when you need to be careful. It's important to strictly follow your doctor's guidance. Changing medication dosages without professional advice can be very dangerous and may cause side effects. Remember, your health is a delicate balance, and medication should be part of a comprehensive approach that includes a healthy lifestyle. So, don't try to manage this on your own. Trust the expertise of your healthcare provider to help you control your condition effectively and improve your sleep in a safe and controlled way. As we wrap up today's discussion, I hope you've gained valuable insight into how small changes in daily habits can bring significant improvements to our overall health and quality of sleep. We talked about the importance of avoiding late-night eating, how pre-sleep activities affect our ability to rest, and why managing chronic conditions is very important for a good night's sleep. But most importantly, I hope you realize how much control you have over your sleep health and overall well-being. Now, I would love to hear from you. What have you learned from this video that you plan to apply in your life? Whether it's avoiding heavy meals before bedtime, creating a relaxing pre-sleep routine, or managing your health conditions. I encourage you to share your thoughts in the comments below. Your experience might inspire others to make positive changes. If you found this video helpful, please take a moment to like, share, and subscribe to our channel. Your support helps us reach more people and continue creating valuable content to help you live better. Don't forget to leave a comment below. Let's keep this conversation going and support each other in making healthier choices every day. Thank you for watching.